knots because you will give only one or two types of knots. So just for the sake of the understanding, let's understand what is a suture knot and what are the different types of suture knot and what suture knot you are going to use in your practice when you are giving sutures. So let's go about it. So let's understand what exactly is a knot. The suture knot has three components. This one is the loop, and this one is the knot part itself, and these are the ears of the knot, right? So basically this loop is that you are passing the needle from one flap to the other flap, and then finally you are knotting the thread, and then you are leaving two threads. You are cutting the thread, and these are called ears. So these are the cut end of the sutures. So this exactly is the structure of a suture knot. So what are the principles of the knot tying? First of all, as you know, these principles of the suturing, that knot should not be very tight. It should not be should not put too much tension on the tissues, and there should not be any strangulation of the tissues when you are tying the knot. So you have to be careful while placing the knot. Knot should not be very tight, and also it should not be very loose. If it is very loose, obviously it is not serving the purpose it should, and the idea is to just hold the suture material and the tissues together, and that is the purpose of the knot. That's it. And the purpose of the knot is also that it should not get opened up before the healing happens. So knots should stay. So how there are different type of knots for that. And according to the suture material also, sometimes you have to change what kind of knot you are giving, how many knots you are giving. Suppose if you are giving using a nylon type of suture, it's a very it's a monofilament suture, very slippery suture, and knot untying property is very high because it possesses some kind of memory. And you know that if you are using nylon suture, you have to put at least 4 knots. So similarly, there are sutures, mostly 2 or 3 knots are more than enough. But if you are suspicious that it is going to get opened up, just put 1 more knot and you are good to go. Okay, and let's discuss what is the overhang knot. Overhang knot is nothing but a simple knot that we usually give with our normal threads. Just simple knot. As if you are tying your laces, and you are just giving the first knot is actually the overhang knot that you are giving. So it is just simple like this only. Square knot, it is commonly used. What is that? One knot is in the clockwise direction and the other knot is in the counterclockwise direction. One knot in the clockwise direction and the other knot is in the anti-clockwise direction. This is called square knot. Very commonly used for synthetic monofilament suture, but it get loosened also. So I usually prefer giving surgeon's knot when I am giving any kind of sutures. We will discuss that also. If we are using granny's knot, which is not very commonly used in oral cavity, what is that? You are giving clockwise knot, 1, and then another clockwise knot. That is granny. 2 clockwise knots are granny knots. What was surgeon's knot? 1 clockwise and 1 anti-clockwise. So granny's knot is one that you will not give anywhere. So either you will give surgeon's knot or the square knot. Now what is surgeon's knot? It is the most commonly used knot when we are giving this, doing the suturing. What is that? 2 clockwise throws and then tie, then 1 anti-clockwise. These are 2 clockwise, 1, 2 means, let me explain. Means you will hold your needle holder like this and you will give 2 clockwise wrapping of your needle, wrapping of your thread onto your needle, and then tying the knot, and then one anti-clockwise, moving of the thread anti-clockwise one time and then tying the knot. That is called surgeon's knot. 2 clockwise throws and then knot, 1 anti-clockwise and then knot. That is called surgeon's knot. You can additionally secure surgeon's knot with the help of the square knot or maybe a overhang knot. So at least I would suggest that you put at least 2 or 3 knots when you're giving sutures, especially the continuous sutures, because you know that first suture is interrupted and then the continuous sutures are like this. So if your first suture is loose because of any reason, because of the suture not properly tightened up or the knot loosening, and it will jeopardize the whole suturing process. So I usually give at least minimum 3 knots when I give the sutures to the patient. So this is everything about suturing knots. So there is nothing more to discuss. There are many knots out there in the books. There is no need for you to learn all those knots except for the theoretical purposes to write in the exams. But as far as the practical purposes are concerned, if you know that much about knots, it's more than enough. So this is all about theory of knots.